Thanks to advances in medicine, diagnostics, and surgery, humans are living longer and healthier lives. These advances, when applied to veterinary medicine, can also help our companion pets live longer and healthier lives. Unfortunately, the resulting increase in life expectancy hasn't been without consequences. A longer lifespan can increase the potential to see diseases and conditions unique to the geriatric patient. Therefore, the veterinary team will need to become more proficient at recognizing normal aging changes as well as possible health concerns unique to a senior pet. In general, we consider a pet to be geriatric at approximately 7 years of age. In dogs, this development differs from breed to breed. For example, the lifespan of larger breed dogs is generally shorter than that of a small dog. Additionally, certain dog breeds are predisposed to develop certain diseases and conditions. Cats typically live longer than dogs, and generally, indoor cats outlive their outdoor counterparts. As a species, cats have disease conditions unique to them, and their organ systems may age differently than dogs. Ideally, all members of a veterinary team will recognize the need to handle our geriatric patients a little differently in order to help them live a longer and healthier life. The key to helping our pets live a longer, healthier life begins with biannual wellness exams. Due to the nature of disease progression, these timely visits with the veterinarian can detect problems early, resulting in prompt treatment and management of a condition. With this in mind, we need to consider developing a geriatric or senior wellness program that offers our clients high-quality medicine with their aging pet in mind. A recommended wellness program should contain 4 sections that include a detailed history that involves a set of specific questions designed for geriatric patients and related to aging, a comprehensive physical exam with special emphasis on detecting diseases found in older animals, a series of diagnostic tests, and finally, client education and discussion of home care responsibilities. Let's look at the program in more detail. This program is first presented to the client when they call to schedule an appointment. At that time, the receptionist will verbally gather information about the pet, age, health status, gender, and any specific concerns that prompted the requested exam. Once that information is obtained, the owner will be informed about the senior wellness programs available. This type of program generally involves lab work, so the owner can be detailed about any applicable special instructions. Additionally, when a urinalysis is a part of the program, a free catch urine sample may be requested at that time. When the day of the appointment arrives, the client will once again be greeted by the receptionist. The client will be checked in and will join a technician in an exam room. The technician's role in a senior wellness program is invaluable. The first step in any comprehensive examination is a detailed and complete history. The client lives with the pet and is familiar with what is normal for the pet and what is not. What makes this exam unique is the type of questions asked. The technician will ask a series of questions designed to assess the aging pet's health as well as any behavioral changes. For example, the technician may ask the client if the dog is eating or drinking normally. What type of diet do they feed the pet? How often is the pet fed? Has there been an increase or decrease in appetite? Is the dog losing weight even though the appetite has increased? Has the pet experienced any vomiting or diarrhea lately? Have there been any changes in how the dog responds to verbal cues? Does the pet seem startled when touched before being spoken to? Does the pet seem disoriented at times or bark at what appears to be nothing? Has the owner noticed any growths on the dog? Does the pet limp or lick excessively at any joints? The list of possible questions is endless, but the important thing is to gather useful information. This type of questioning may also jog the owner's memory. For example, the owner may have noticed a change or something new in the pet's behavior, but had forgotten about it until the question arose. The detailed history will then be used by the veterinarian as a tool for the next step in a senior wellness examination. The second portion of a senior wellness program involves a comprehensive examination by a veterinarian. The current recommendation is that a physical exam be performed every 6 months for older pets. Since pets age faster than humans, problems can and do arise much more quickly. These problems need to be identified before they become life-threatening or unmanageable. The initial portion of the exam will involve a physical examination that involves all of the body systems, as well as inquiries into any behavioral changes or concerns. As a pet enters its golden years, they may become more aloof, nervous, or needy. Additionally, their activity level may decline or almost stop. They may sleep most of the day and appear to be depressed. All of these factors are taken into consideration. The veterinarian may begin the exam by checking the pet's eyes for normal aging changes, as well as for cataracts, retinal degeneration, glaucoma, and dry eye. If warranted, a more extensive ophthalmic examination would include fluorescein stain, tonometry, and Schirmer tear test. These tests are helpful in detecting ocular disease. Older pets may begin to have trouble hearing due to changes in the nerves and small bones in the ear. The veterinarian will examine the ears and take note of any odors, discharges, or abnormalities of the pinna and ear canal. The oral cavity will be thoroughly examined due to the high incidence of dental disease in older pets. The gingiva will be checked for signs of redness, swelling, bleeding, or pain. Bacterial infections of infected gums can lead to problems with blood-rich organs, such as kidneys and liver. Potential health risks associated with these conditions, as well as preventative measures, will be discussed at the end of the exam. Auscultation of the heart and lungs will help detect any murmurs and abnormal rhythms. Palpating the abdomen and entire body surface will help detect any obvious masses. The pet's joints will be manipulated to check for pain, swelling, or crepitus that could be a sign of arthritis. In veterinary medicine, arthritis is more accurately referred to as osteoarthritis and is an extremely prevalent geriatric disease. With modern advances in pain medication, this disease has been managed with great success. Lastly, the rectal and reproductive areas will be checked for abnormal discharges, swelling, and lumps. Following the actual physical exam, the doctor will address any owner concerns and discuss some maintenance items. Due to changes in vaccination protocols, we need to discuss which vaccinations are appropriate for a senior pet and at what intervals they should be administered. As a pet ages, a weakening of its immune system may occur. This process creates increased susceptibility to disease that can normally be prevented by routine vaccinations. The pet's veterinarian is the best person to evaluate geriatric risk factors. These factors typically include age, exposure, disease prevalence, concurrent diseases, and other variables that may be present. Geriatric pets also need to be protected against both internal and external parasites. Internal parasites can be picked up anywhere other animals defecate. Ineffective eggs will attach to the pet's hair coat and paws. Both licking and chewing transfer the egg to the oral cavity. When a senior pet is arthritic and tends to lick at sore joints, this transference is more likely. Fortunately, most of the current heartworm preventatives help control common internal parasites. Fleas and ticks also threaten the health of older pets. These particular parasites live off the host's blood, so a pet with a weakened immune system and suppressed bone marrow are at risk of developing life-threatening anemias. The veterinarian will work with the owner to find a product safe and effective for the pet. Diagnostic tests are an important part of formulating an accurate diagnosis and are therefore included in the third portion of a geriatric wellness exam. A complete blood count, serum chemistry panel, electrolytes assay, and urinalysis are all vital components of a thorough senior wellness exam. Analysis of both blood and urine are tools used to help detect early signs of systemic illness such as diabetes, kidney, or liver disease. For example, as animals age, the kidneys tend to become less efficient and are unable to conserve water and electrolytes. Two specific tests that may be included in a geriatric profile are BUN and creatinine. Depending on the facility, these lab tests may be performed in-house or may be submitted to a diagnostic laboratory. In addition to the aforementioned tools, supplemental diagnostic testing, such as radiographs, are often performed to make a definitive diagnosis or help with designing a treatment regimen. Diagnostic imaging can help detect possible heart enlargement, arthritic changes, and bladder stones. An electrocardiogram may be a valuable addition to a senior wellness program. When indicated, ultrasonography can further confirm heart chamber abnormalities and changes in the architecture of different organs such as the liver, kidneys, or spleen. The detailed history, the findings of the specialized geriatric physical exam, and the results of the various diagnostic tests are then gathered and analyzed by the veterinarian. If any of the lab work was sent out for analysis, the veterinarian may postpone any discussion with the pet owner until all test results can be evaluated. Once all aspects of the wellness exam have been completed and reviewed, diagnosis, specific plans, medications, special diet, and all other recommendations will be discussed in detail with the client. At this time, specifically if the pet has been diagnosed with a disease, the owner may be too distracted or upset to ask any questions. Supplemental handouts are beneficial and allow the client to slowly digest the often overwhelming amount of medical information. To be complete, an effective senior wellness program must also involve the client. This is the fourth and final segment of the program. Involving the client simply means they will play an active role in certain aspects of their pet's care. This can range from the decision-making process with regard to treatment options to complying with home care and preventative measures. Having the owner involved in the wellness protocol is beneficial to both pet and owner. Diseases involving the oral cavity and their prevention are a very important part of a senior wellness program and often include home care. Older pets often have a great deal of tartar buildup and gingival disease, leading to foul-smelling breath. Additionally, the oral cavity is a direct route to blood-rich organs, so it is imperative to keep an aging pet's mouth healthy. The veterinarian will work with the client to develop an at-home oral hygiene regimen that is both effective and easy for the client to perform. If the client feels that they are either hurting the dog or it involves too much time, they are less likely to be compliant. Several products ranging from toothpaste to antiseptic rinses are available. Diet and exercise play a major role in disease prevention throughout a pet's life, and the client is directly responsible for both. They buy the pet's food and determine the level of exercise the pet will get. During the geriatric pet's biannual wellness exam, details about the pet's diet, amount of food consumed, and amount of exercise will be gathered by the technician. The diet and exercise regimen may then be modified based on the results of both the specialized physical exam and the results of the diagnostic testing. Advances in companion animal nutrition have resulted in a wide array of diets being available for the older pet. These diets can help damaged organs function and may slow down the normal aging process. Some foods contain supplements that help the brain stay alert, while others contain supplements that aid in keeping bones and joints healthy. Newer research has shown that if certain diets are fed when a problem is first detected in an asymptomatic pet, the food will have a greater likelihood of slowing down the degradation and will truly increase the pet's active life. The veterinarian will work to create a nutritional regimen specifically for that pet. Companion pets are living longer now, and veterinary professionals need to develop ways of keeping them healthy as they age. Management of geriatric pets starts at the veterinary hospital and continues into the client's home. A home care program, along with a nutritional recommendation, will leave the client feeling like a part of a bigger plan. Perhaps a well-informed pet owner is the most important team member. A tail wag from a comfortable, happy dog may be all the reassurance an involved pet owner needs.